Welcome back to STL Live. I'm Andy Ruzicka, here with Public Health Program Supervisor Michele Welker. Talking, of course, all about the flu, all things flu. You must know so much about this virus. It's unbelievable. So can you tell me about for those of us who've already had the flu shot, are they still at risk?
The flu shot protects against certain strains. There are going to be certain strains that come around that maybe they would not be immune to, but it will help their symptoms be a little bit lesser.
Who's at the highest risk for getting the flu?
The highest risk and the people with the highest kind of complications are children who are under, especially age of 5, ages 60, or people 65 and older, people who have underlying health conditions or chronic disease, like diabetes or asthma. They could have much more severe complications from the flu, and pregnant women also.
So, flu season being from fall and winter, do you think when say climate change in St. Louis changes the weather, that the flu season will be even shorter, or is it kind of the weather doesn't typically affect flu season?
From what I understand, the weather does not typically affect that. So what we really try to concentrate on is what we can do to prevent it, to make sure that we're doing everything that we are capable of to prevent spread of the disease.
And do you recommend people cough and sneeze in their arm?
Yes.
Best practices?
So you don't want to do it with the hand. So you either want to use a Kleenex, and of course, after you use that Kleenex, throw it away. You don't keep it and put it in your sleeve or anything like that. Or you want to kind of do the technique where you cough in your arm. That's really just trying to prevent those droplets from being in the air.
What do we do? We're busy professionals at work. We all want to try to get done at work, and you may just have a cold. Do you recommend people who may just think they just might have a cold to maybe stay home an extra day, or maybe make sure just disinfect everything that they touch throughout the day?
Yes. So if you are ill, we do recommend you staying at home. You don't want, whether it's a cold or the flu, you don't want to pass that along to your coworkers or to other people, and you just want to be careful with that.
So what are the trends, St. Louis versus nationally, with the flu numbers being high at both?
You know what? It is about that time when numbers are increasing. And right now, in the last couple of weeks, we have seen some additional or increase in cases in the St. Louis area. And that's trending about, I think, normally in the U.S.
Mm-hmm. So after you've gotten the flu, is there anything, maybe care after the flu, that you need to take your body to make sure that you kind of recover safely?
We always, of course, recommend, if you're struggling with the flu or if you're having a lot of symptoms, to consult your healthcare professional. But if you are recovering, of course, just concentrate on getting that rest and plenty of fluids. So
the St. Louis City Health Department and the county are more kind of coordinated more than ever. Do you, as a kind of unified department in a way, do anything to help combat flu regionally?
There are a few things that we are working together on. We have our own individual cases, but of course, as an entire region, the flu doesn't stop at the city or county line or versus other areas, even into Illinois. So of course, we work kind of as a region to try to prevent the spread.
Excellent. Well, you had so much good information. I think, more people will stay home if they're sick, especially.
Yeah. Yes.
I will do so myself in the future, I promise. So there you have it from the City of St. Louis Health Department themselves, how to stay away from the flu and avoid getting sick. To learn more about staying clear of flu season, visit stlouis-mo.gov. There's more STL Live after this, though. Don't go away. We'll be right back.